Almost each year in Uganda, the Ministry of Health expects to get about 90,000 pregnant women infected with HIV. This means that 90,000 babies each year are at a high risk of getting the virus. But there have been measures over the years like prevention of mother-to-child transmission, which is now turned to elimination of mother-to-child transmission. Dr. Moses Walakira from the Elizabeth Glether Pediatric AIDS Foundation, which fights new infections in children, says that this has helped in averting new cases.
Generally in Uganda, approximately 26,000 children get infected from their mothers annually. And without any intervention, it means that every year we shall be having 26 additional new infections. 26,000.
About 95% of infections in children are through mother-to-child transmission during pregnancy, delivery, and breastfeeding. Against this backdrop, the Ministry of Health is renewing efforts to curb the HIV infections in children. It has launched an antiretroviral therapy regimen called Option B+.
And we shall be giving the antiretrovirals to all HIV-positive pregnant women from 3.5 months of pregnancy, and they will take these drugs for life. To the born baby, antiretroviral syrups shall be given for 6 weeks, which is a big relief compared to what has been happening before.
And our target right now in Uganda, as also the global targets, we are aiming at achieving elimination of mother transmission targets by 2015.
HIV-positive mothers have to embrace these interventions if results are to be achieved.
All pregnant women attending antenatal clinics, all pregnant women getting tested for HIV. It means identifying the HIV-positive pregnant women, and they are started on antiretroviral drugs, which are Option B drugs.
We have already enrolled some clients on Option B+. Yeah.
When did you start this?
2 weeks back.
So how is it coming along?
So far we've not had any problem with it. We are doing well, we are progressing with our clients, and they are coping up. We've not had clients with side effects, we've not had complaints so far.
Many countries have taken on Option B+ since WHO recommended it in 2012 as the third better option to A and B, under which an HIV-infected mother stops taking ARVs shortly after delivery when their immunity improves.
We shall reduce the transmission to less than 2,000 children per year, and that is equivalent to less than 5% infection rate.
History will blame us if Uganda continues to have children who are sick.
Now, for a period of 2 years, the Swedish International Development Agency, SIDA, will invest about 16 billion shillings, about $6 million to help with eliminating HIV in children in 19 districts, to be implemented by Elizabeth Glether Pediatric AIDS Foundation and UNICEF. The US government already offered the country 65 billion shillings, an equivalent of $25 million for the Option B+ program, and will continue giving 30 billion shillings, about $15 million each year for the next 5 years. This is when the ministry is expected to have covered the whole country.
All of us share a commitment to ensuring that no Ugandan child is born HIV positive, that no child is compelled to begin life with a burden that no child should ever have to bear.
With all the measures and the money put in to fight new infections in children, the Ministry of Health and the First Lady Janet Museveni insist on prevention against HIV by use of the available preventative methods, including abstinence, being faithful to one partner, condom use, amongst other preventative measures, like people at risk of getting HIV taking a daily pill to reduce their risk of becoming infected.
Even though we know that we now have antiretroviral drugs, nonetheless we must tell our people and sensitize communities to know that they have the responsibility to protect themselves. They cannot just look to drugs. Anybody who's looking for drugs is a sick person.
The Uganda AIDS Commission calls Option B+ the last card after all the preventive measures against HIV have not been adequately applied. Florence Nalimba, NTV, Itojo, Ntungamo District.